What have you stayed silent about in medicine because you worried what others might think? That's what we're talking about today. If you're a doctor, healthcare leader, or patient, you belong here. I'm Kim Downey, and this is Stand Up for Doctors Conversations at the Intersection of Connection, Courage, and the Future of Healthcare. This episode is sponsored by Brian Case at Direct Wealth Care, helping physicians navigate the financial stress no one talks about in medicine with conflict free tools and resources. And today I'm thrilled to welcome Dr. David Lawson and Dr. Catherine Lawson. Thanks for joining us today, David and Catherine.
Yes.
Thank you for
Um,
having us.
Thank you.
You are very welcome. And by way of a very brief introduction, because I want you to introduce yourselves, Dr. David Lawson is a hematology oncologist with decades of extensive experience.
Yeah.
And Dr. Catherine Lawson is a licensed clinical psychologist focused on the mental health needs of healthcare professionals. And Catherine and I met, we're both ambassadors for Dr. Learner Breen Heroes Foundation. We met a year ago, March. So this episode has been 15 months coming. So thank you for your patience. And I have met Catherine in person, but David, we have not met yet. So what would you like us to know about you?
I am a medical oncologist, and I've been at the same place for my whole career, and ups and downs, as we will talk about, I'm sure. But um, but I'm very glad to be here, and thank you very much for doing all this.
You're welcome, and you're my first father-daughter couple. I've had husband and wife physician, if like physician spouse was on, and I've had siblings on, but I have not yet had a
Yeah,
parent-child. So, and you can
yeah.
actually add to the introductions for each other in case you're both too modest. So,
Oh,
Catherine,
okay.
maybe you could add anything that you think we should know about your dad, and then introduce yourself.
Sure. So I was actually, of this part, I don't, of course, remember. I was born when Dad was still in med school. So he has been a physician or a physician in training throughout my life. And I have to say, one of the motivations for the practice, which I will talk about more about my practice, was really being in a medical household, even before I worked in hospital settings myself, but just really seeing that dedication and that compassion and just really that desire to help patients and also balancing that with other lifetime needs. So I am I kind of introduced myself more than my dad. Sorry, Dad.
No, no, no. That's fine.
but,
That's
but
fine.
I think really the kind of the down or the foundational principle being just that a lifetime of watching his commitment to cancer care has been a major motivator in doing the work that I'm doing.
Well, I want to take a pause and thank both of you so very much. I've recently had cancer 3 times, and I have my own hematology oncologist, and I love him. He's incredible. So you save lives, and I appreciate you so much. And then Catherine, who works, with doctors or healthcare professionals, to support them. It's the work both of you are doing is so critical, and that's why I'm so happy to have this conversation. And I like our guests, if they're comfortable, to share a powerful story. So I know, David, you said you've had some ups and downs. So related to our chat today, is there something you'd like to share?
Hmm. Well, I mean, certainly there have been ups and downs. One story that comes to mind from my training years when I was a resident, and Catherine, I think, remembers a little bit of this, but I was on a rotation where I was going to have one day off that whole month, and which is was typical. And I remember getting a call from the chief resident that the guy who was supposed to be on that day that I was supposed to be off broke his leg. And so I remember, and so I wasn't going to get the day off. And that, but I remember all the things I went through. I don't know if I said this or not, but I remember thinking, well, can't he just get a cast? Show up, and that. But I remember part of what I think about it now is it was unthinkable that I wouldn't go. That never occurred to me. Uh, and I did have some notion that he should go, no matter what was bothering him. And so I think about that, and that's kind of unreasonable. It's kind of unreasonable. It's more than kind of unreasonable. It is unreasonable. But that's the sort of thing, or the sort of expectation I think that we put on ourselves, is that we will do these things, even if it's hard. And so anyway, I remember that story. Catherine remembers it too.
Well, it's
Yeah,
a
yeah,
powerful story on
yeah.
both ways. Like, number one, as a doctor, you should not be expected to work 30 days in a row with only one
Right,
day off. How
right,
could you show up at your best for a patient, for patients
right,
with that?
right.
So that
Yeah.
is the first problem, is those are just unreasonable expectations. And I've spoken with doctors who worked before the work limits who had worked like 120 hours in a week.
Oh yeah, yeah,
And that is just not practical or appropriate. So then the flip side of that is that when you're that exhausted and those thoughts pop into your head, like that's it's reasonable and unreasonable. Like, of course, you couldn't shouldn't have
yeah,
expected
yeah,
the guy to come in with a
yeah,
broken leg. But on
yeah.
the other hand, when you're so exhausted, like in we
Yeah,
have two
that's
books,
right.
and the anesthesiologist who wrote a chapter in our first book, he wrote his own book, Saving Grace: What Patients Teach Us About Life, Death, and the Balance in Between. And
Oh,
he shared
okay.
once he was totally exhausted, called in the middle of the night for a surgery, and it seemed like the guy was in like really, really bad shape, wasn't probably going to make it anyway. And he had thoughts that he almost, of course, he was performing his best during the
Mhm.
surgery, but almost wishing, let's just get this over. We know it's not
Good,
going to
yeah.
be good for the guy. So, of course, he didn't want the patient to die. And of course, he did his best. But just those thoughts that go through your head, those would be normal human thoughts when you're exhausted.
Yeah,
But I think some doctors can then experience shame or beat themselves up or think, oh, I'm a bad person or I'm a horrible
yeah,
doctor for
yeah,
having those thoughts.
yeah. Yep, all of that is true. All of that is very true. Yeah, very true.
So, Catherine, what does that bring up for you? And if you'd like to then go into your own and into a story that you'd like to share.
Yeah, so I mean, I think that it is, you put it so beautifully, Kim. When we're in as humans in situations with limited resources, including resources for rest and relaxation, it's it can start to tear not only at us, but at the sense of community, where we're resenting other people who are actually doing their best too, and doing everything that is humanly possible for them as well. And so I think that it's just can be very difficult in those circumstances and in those situations to understand that it's just this sometimes this overwhelming amount of work. And one thing that I think is true about being a psychologist, about being a physical health provider, taking care of people is it is a joy to me. It is a joy and a pleasure, and it is also a tremendous obligation. That when you kind of sign up to say, yes, I want to take care of people, that there are some of those pressures. You mentioned kind of changing over to what you talked about, shame. I think though within that, it's not an yes and a but. It's yes and yes. You can feel absolutely committed, passionate about patient care, dedicated to the mission. You can feel all those things. You can get genuine joy from the work, and also we are all humans. We are all humans.
Mhm.
Every single one of us has limits. Every single one of us has what we cannot do. And I think within I see it more in medicine certainly than in mental health care, what you're talking about, this sense of shame, and then this sort of baked in bone deep feeling of failure or inadequacy for just being a person,
Yeah,
just having normal human needs that the system does not always allow you to meet. So I think one of the stories that really kind of set me on the path to working with healthcare professionals, which was way before I ever started the practice. I worked for the federal government for about 15 years before I went into practice. I worked in correctional hospitals and correctional institutions and also mainline hospitals, civilian hospitals, that kind of thing. So when I was in correctional healthcare, the medical director in this, I'm just wildly understaffed, under-resourced,
Mm,
rural Southern prison had a sign on his desk that said, "Inmates don't interrupt our work. They're the reason for our work." And
mm,
he just had this
mm,
absolute frame of patient care against all those obstacles. And I mean, he fought that, not that every day. He showed up as his best self every single day. And so it just was sort of the seeds that would
mm,
eventually kind of come out to be what this practice is, just watching that dedication and that devotion.
mm.
Wow. Well, I love that because that was a reminder for him and everyone who saw that message. So that was terrific. So, David, what Catherine said, whatever that brings up for you. And then I have a question because you've been practicing for a while.
Mhm.
And I wonder if you feel, in your opinion, like his medicine becomes safer for physicians to be human, or are we just talking about it more?
It has become safer, I think. And over my lifetime, I have seen changes. Like when my children were born, we didn't have paternal and or maternal leave, and now we do. And most people have it, and it's expected that people will want to take time off for these events. And we have work, our limitations on how much our residents can work. They have day limitations. I mean, this situation would not come up these days, of where I didn't have but one day off, and that day got taken off because that guy broken his leg. But anyway, yeah, things are better, and we are talking about it more, and that's part of why things are better is because we're talking about it more. So thank you for having this podcast.
Well, you're welcome because I say all the time, every time a doctor shares their story, another doctor feels less alone. And I'm grateful to every single doctor who comes on and shares their story because I think that is how we change and how more doctors do feel comfortable and safe speaking up. And there's some things that should be changed, which kind of leads me into like our next question that you could both answer. I'm wondering like what beliefs about like strength, vulnerability, and success in medicine need to be retired.
Mm. Oh, okay. Uh, do you want to go first, Catherine?
I have one. Yeah.
Yeah,
I think
yeah.
the idea that, shame or fear of failure is a kind of a prerequisite or a foundation for excellence, that's got to go. That it is not. I mean, there is a sort of an optimal zone of anxiety. So if we have zero anxiety about something, we underperform because we have zero. If we have this overwhelming anxiety of, and this is not to, I'll acknowledge openly, the stakes are high. That's not a cognitive distortion. That's true. The
Mm,
stakes are high. And also, we don't perform at our best with this constant sense of, fear of making a mistake or not being able to move past a mistake or, really being
yeah.
punitive and self-punitive for errors because the truth is no matter how hard you work, no matter how smart you are, no matter how much you do not want to make them, you will. We don't even need to fight that. I mean, that'd be like saying, like, I really don't want the sun to rise tomorrow. It's going to. The sun will rise tomorrow and
Yeah.
you, healthcare professional will make a mistake. And
Mm,
so the question is, how, you know, dealing with that. But I think that really it hurts me, and it's something that I see pretty frequently. People don't want to extend compassion to themselves because of the worry. Well, then I'll just keep on making mistakes. Well, then I'm not. adequately dedicated to patient care, well, then I'm not doing what I'm supposed to do. But there's research just with physicians, although I would assume it is across the spectrum of different, professionals within the medical field. But the only research I know of is physicians that self-compassion not only does it reduce the anxiety, the depression, the suffering of the physician practicing self-compassion, it reduces patient error. It improves,
Mhm.
safe, outcomes. It's just really a win. So that I think that's my number one thing. Anxiety, fear of making mistakes, beating oneself up does not equal excellence.
Yeah, yeah. I think Catherine taught me, and it's very true, that I am the instrument that I bring to the patient's bedside. And if my instrument is not good, if my knife is not sharp, then I don't bring my best self. And so I think her point that we have to take care of ourselves in order to take care of our patients is very true, and it's very true. And to some extent, I still think that that's the justification for taking care of ourselves is so that we can do what we need to do for our patients. And I know I don't think that's totally the justification, but it's part of it. It's part of it. It's part of it.
Right, and
So,
of course you shouldn't need permission or justification, but if you do need it, that's it. And I love that, like literally and metaphorical, that you are the instrument.
yeah.
That's beautifully said. And I love, Catherine, what you said, about an optimal zone of anxiety, because that's interesting, because
Mhm.
it's not, right, like an all or none, that there is that optimal zone.
Yeah.
And also as far as making mistakes. Dr. Michael Hirsch interviewed Dr. Amy Vertrees, and she shared on his episode that this was specifically for like proceduralists or surgeons, but it could be extended to other specialties. Is when you're giving the patient true informed consent, that you're consenting to the same things. So when
Uh,
you're saying, that this patient could have numbness and tingling,
mhm,
they could
mhm.
be hoarse or, whatever, they could die. Like
Yeah.
that you're thinking that you're telling them, but that every single time you have to realize that you're acknowledging that those things could happen, and
Yeah.
that's a risk that you both have to be willing to take.
Yeah. That's a good
True,
point. Yeah.
true.
That's a very
And
good
then,
point.
and with the self-compassion again, Dr. Joe Sherman, he's coming to our physician retreat, and he speaks a lot to self-compassion and
Hmm.
how very, very important that is. It's actually critical. It's self-compassion starting with yourself, because often you'll extend compassion to everyone or more compassion to your patients, to your colleagues, and not so much, unfortunately, to yourself. So how do you vision, or David, what are the changes you have seen? Like, what would medicine look like if physicians felt as comfortable seeking support as they do providing it?
That's an interesting question, and I think that's going to be a hard state to achieve because of the nature of what it takes us to get to be physicians. I mean, we are competitive and we are driven as a lot and as a group, and so I think we tend not to have compassion on ourselves, and so it's going to be hard to teach us to do that. To do that. Now, I think the world would be better if we did. No, if we did, and that. But I do think it's going to be a hard thing to teach us. We will always have that tendency to think I could have done more, or I could have been better. And maybe to judge our compatriots, who do fall, by the side, and to to judge them. So yeah, I think it will be better, but I think it's going to be hard to teach us to do.
Oh,
on,
and this is some of the work that Catherine does, right? So
yes,
what are your
yes.
what do you want to say to respond to your dad, and what are the tools that you're using to work towards
Yeah,
that?
yeah,
Uh,
no, wonderful. I mean, I think
yeah.
one of the first one is what I already said is, trying to break that
Mhm.
idea of excellence being part of being hard on yourself. But I think the other thing is that, and this just is a tough thing that shame frequently prevents medical professionals from seeking help, and the help would help combat the shame. And so it's this really ugly catch 22, which is why I really like talking on podcasts and doing non-clinical things. So, hey, if you don't feel comfortable coming to talk to a psychologist, that's okay. Let me come talk to you. And so, just to really see this, it's really, I think, conversation by conversation. I think it's, slow. I think that there are institutions that actually have very robust, wellness programs that are actually doing great work. And even by just existing, are doing the work of saying you deserve to be well. And
Mhm.
we value you and we value your wellness. So those are some of the things that I would say sort of writ large within, the techniques that I use. Some of them are, this is one of my favorite self-compassion techniques is what would you do if a friend came to you with this? I think it's so powerful and it captures exactly what my dad was just talking about, that there is a tendency in which you talked about too, Kim, a tendency a lot of times to be far more compassionate to others than to oneself. So, if a friend came and said, "Oh, I forgot to check whatever, fill in error here. I forgot to do this," is your friend going to say, "Oh, I can't believe you're even a doctor. Why did they let you into med
Yeah,
school? La 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 la."
yeah,
These
yeah,
narratives that people can get
yeah,
on where it's just these just
yeah.
really abusive. No, your friend is not going to say that. So when you think about that, you can say, no, we're not going to do that. Something else, and this I talk to people a lot about thoughts stopping. So a lot of times I like to do like challenging the thought, is this really true? Am I really the worst doctor who ever lived? No, I'm not because X, Y, and Z. But what can happen sometimes is that, they're excellent prosecuting attorneys. Yeah,
Yeah.
but they probably just gave you that award because they felt sorry for you, And so rather than combating the thought, it's increasing the engagement with it. And so sometimes I just like thought stopping. Just, hey, stop. You don't need that. Yeah, but you made that mistake. Stop. You don't need that. You just tell yourself, I have that, whatever the symbol is, red light, police officer, whatever says stop to you. You get that image in your mind, you stop. You don't need that. I'm not going to go down this path because the more often we have those kinds of thoughts, the easier it is to have them again. I mean, it becomes a habit even to have those negative thoughts. And so to stop that, I think is a powerful step.
Mm. Yeah.
Mm. Yeah, that is so well said. And I like the thought stopping. And I know some people say like do a thought download, right? Or even just write it all down, but then give yourself like 15 minutes to ruminate. Because ruminating, right? It's related to ruminating. And
Yeah.
Yes.
just giving yourself maybe even a time limit if you're going to do it.
Yeah.
Yeah, no,
Yeah.
exactly, exactly, because otherwise you'll just stay consumed by it.
Mm.
And that's human too. But what I see sometimes is, so we'll talk about, self-compassion and what would a friend tell you, and let's try to practice some of these things. And a lot of physicians are very competitive and very driven to succeed. And so if if they don't do all the self-compassion exercises at first, it's like, now I messed up on the self-compassion exercise. It's like, let's not, no, no, no,
Yeah,
stop.
right.
This part's
Yeah.
not a
Yeah.
competition, right? Well, it will come in its own time. You will do it when it is right for you. This I also know. People do it when it's right for them. They really do. So if you're not doing it yet, hey, it's not the right intervention or it's not the right time, and that's not a failing on the person's part. It's not a failing of the intervention necessarily. It just might be a mismatch.
Right. Well, David, I'd love you to take a few minutes to just share some of your wisdom, like whatever you want to say, because you've been in medicine for a long time and you're still practicing, is my understanding,
Yeah.
correct?
Yeah. I am. I am. Um, I thought about it a little bit, and just to reinforce a couple of the things that Catherine said. I mean, I think whenever you do find meaning, whenever you get that feeling of, okay, this is really worthwhile, savor it, hang on to it, you know,
Mhm.
and savor the feeling. And we're often not feeling oriented, but let that feeling wash over you, as it will, and try to remember it and try to remember that, recall that feeling sometimes when you really feel down, and out. And I think that helps a lot for me. And the other thing that I would to reemphasize or to emphasize what Catherine was saying, I mean, you have to have connection with other people.
Mhm.
You have to, and because you're human, as humans, we all need that. And sometimes it's hard for us to find that, because of the environment that we live in and all. But if you don't see it, or if you have an issue, let's say, that you can't figure out or something like that, if your needs are best met by seeing a professional like Catherine, then do it. Then do it. I mean, as you said, there should not be any stigma associated with that. Now, I will agree that sometimes you have to be careful, because there's vulnerability. And,
Mhm.
you're gonna tell things about yourself that you don't necessarily want everybody to know. And you can't trust everybody. But generally, you can trust a professional. And generally, you're gonna get suggestions, insight that you might not get from a non-professional. So, I mean, those are a couple of things that I would say, I don't know if it's wisdom, but I've been at it for a while. And I mean, these are things that strike me as being helpful, that
Yeah.
have been helpful to me.
Yeah, no, I fully agree. And I know that some
Yeah.
doctors are getting so busy, if a patient says thank you, they're already out the door. But like
Yeah.
Dr. Michael Hirsch,
Yeah.
my physician coach, has said that now if he's walking out the door and a patient says thank you or says a kind word, he'll turn around, like, right, look him in the eye, acknowledge that, he puts his hand on the doorknob, and exactly what you're saying is take
Yeah.
in that feeling, right? And then
Yeah.
doctors also save like every card, note, letter, gift, unless it was perishable, right?
Right. Yeah.
That patients give them.
Yeah. Yeah.
And then they go back and look on that
Yeah.
at those things at hard times. So that's that remembering
Yeah.
part. So
Hmm.
these aren't they're little things, but they're not little things, right? It's when the little things are the big things,
Yeah.
and being able to find that connection with other people. And one thing I'm doing for that is having a physician retreat this fall to give
Ah,
them the
good.
opportunity to connect in person, to have these deep conversations, to have that sense of community that sometimes can be difficult to find.
Yeah.
And I love that you speak to, vulnerability, and that it is also important to find someone you feel safe and comfortable with, and that you should
Yeah.
be able to trust, like a licensed professional. But
Hmm.
also, even there, it's where you're comfortable, because some people don't feel comfortable, like, say, their health
Yeah.
program or their healthcare system offered something in the system.
Yeah.
Sometimes they don't feel comfortable with that. And if you don't,
Yeah.
you can go outside the system, right? And there
Yeah.
are, many resources, and Catherine can add to whatever, like, your both of us just said, and
Mhm.
share some resources of your own, or thoughts.
Yeah.
Yeah, well, there was one other thing, and Dad, you had mentioned this to me earlier when we were talking about this,
Mhm.
about the sort of how do you stay in, meaning and connection. But
Mhm.
also, what you had said to me was, just a reminder that the hard times don't last forever. So there are
Mhm.
Yeah.
ups and downs. Bring, when the ups are there, those moments, bring
Yeah.
them in, savor them. But the downtime, and this is human too. It feels like it's always going to be that way.
Mm.
But but probably not,
Probably not.
probably not. And so if we can just kind of keep that in mind, like, this is a downtime. We can even just label it. This is a downtime. This is a bad time. This is a time when I don't feel up for the work, whatever that is. But this is a time. This is not a me. This is not the state of the world forever and ever. This is this moment, and that can be helpful. So I'm glad that you asked about resources too. There are a lot. I mean, I think that there's increasing conversation and attention to the mental health needs and just well-being in general of healthcare providers. I will talk a little bit. I've recently joined the board of the Emotional PPE Project, and I am just passionate about the work that they do. And so, for people who don't know, it is, they maintain a therapist directory. Healthcare professionals can get free healthcare from a therapist in the directory. You just go on and find them. And I think the project, to me, it's just so exciting. I've been in the directory for a long time before I joined the board. So this has been sort of a step, a deepening of the commitment to the mission and the organization. But it is not just about removing the financial burden of connecting to a therapist. And it's not just about removing the burden of maybe you connect to a therapist who doesn't really know anything about medical culture, or you're explaining your workload, or you're really having to do a lot. You're having to teach the therapist how to help you. And so, although those are important too, it's really, I think, so powerful in normalizing the need for mental health care. And also it is an opportunity for the therapists in the directory. And when we have our community forums, it is an opportunity to give back. And it is something that is really it's a gift, or it's intended to be. And so it's just very positive. I would recommend that people look at that. There's out there, you mentioned Dr. Sherman, of course, Physicians Anonymous. I'm sure he's talked about that some too, but just really increasing number of programs within the institutions or organizations, and also outside. And so, one thing that I say frequently is, you know, the therapy relationship is a professional relationship. It is still a relationship. So if you see one therapist one time, and you don't like them, or it doesn't work, or that, don't throw the baby out with the bathwater. I find myself saying that a lot. That doesn't mean therapy does not work. It means, whatever, you didn't click with that person, or that person might not be any good. I don't know, right? But that discrete incident was not helpful. That doesn't mean that therapy as a whole is not helpful. We all are ourselves. So, we bring our own styles and approaches and personalities to the work. That's not going to work for everybody, and that's okay too. But somebody will. Somebody will work.
All of that is so important to share, and I'm gonna actually have to have people from the Emotional PPE Project on. I've just connected a physician with them, and I
Yes.
love that you share. Basically, you didn't say it in so many words, but that life is 50-50. And if you, Dr. Michael Hirsch has taught me that too. So yes, there are going to be hard times. So almost to it, it's almost like accepting
Yeah.
it or riding the wave. Not that as far as accepting it that it's bad right now, but not resigning yourself to it's always going to be that you can still
Mhm.
take action to make things better, but to realize that it is 50-50, and there are going to be good days and bad days. And as David, you said, periods over, the time of your career, right? The good and the bad. And that also, as we've mentioned, the Dr. Lauren Green Heroes Foundation, there's also resources on that site as well. Well, this has been fantastic. And David, do you have any parting words for our audience?
I wrote down a one sentence, like you
Oh,
said, but it's hard for me to get it all in one sentence, so I'll almost have to read it. But I was
okay.
going to say, seek connection. You need a safe connection because you're human, and that's enough. And if it will best meet your needs, that this connection be with a professional, then don't let shame or or stigma get in your way of doing it.
I love that. Thank you. Catherine?
I think my sentence or my last thought would be if you need help, this is sort of along the same lines. If you need help,
Mhm.
reach out for it. And the same help doesn't help everyone, right? It's different people have different needs. Whatever your needs are, they are yours. And because of that, they're valid and they deserve attention. And so I would just say, it can be very hard to do. And there is still a significant stigma a lot of times around mental health care. But it's that's a deficit mindset that I messed up. It's not a one sentence.
It's
Yeah.
okay.
It's a deficit mindset that doesn't need to be there. That we all have these needs. And if you would break your leg and be like, I guess it's just going to knit itself back together, it won't. And if you're
Yeah.
having a
Yeah.
major depressive episode and you're like, I guess it's just going to knit itself back together, probably not, right? That
Yeah,
these are
probably
just
not.
interventions that have nothing to do with your resourcefulness, your strength, this is just, we're human and we have these needs.
Mhm. Yeah.
Yes. Well, thank you so much. I believe this is going to be episode 163, if I'm not mistaken.
Okay.
So I feel like I've interviewed people who have needed help, people who have sought out help, people who have, been the helpers and all
Mhm.
of that. So if we just keep showing this, that yes, this is human, it's okay to need help, and then to
Yeah.
spotlight people who out there like yourselves, like that
Mhm.
people can see. And I recently had on a couple addiction medicine physicians and people could see that they really care. They're not going to judge you. So if we just keep spotlighting people that have needed
Yeah.
help and say, "Hey, I needed help. I'm not afraid to admit it, and there's help out there," and then also featuring the helpers, we're gonna make a difference.
Yes.
Yes, we
Yes.
are. Yes,
Yes.
we
Yeah.
are.
And thank you for what you're doing.
Oh, well,
Yeah,
you're
thank
very
you.
welcome, and
Thank
thanks again for being my
you.
guest. I love this. This will go down for posterity.
All right. All
This
right.
conversation.
Okay.
Fair
And
enough.
thank you
Um,
all for being part of our Stand Up for Doctors global neighborhood, a place where physicians and those who care about them can connect, empower, recharge, and celebrate. You'll find more stories like this in our White Coats book series. And if you're a doctor, we'd love to welcome you to our inaugural physician retreat this October, where these conversations continue in person. Would be honored to have you join us. And if you'd like to help sustain this podcast, please consider sponsoring an episode or connecting us with a mission aligned sponsor. Links are in the show notes, including how to reach out to our guests. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.